So, as we've discussed in class before, opioids affect millions of people across the country and around the world. I have some personal experience. My uncle, several years ago, was thought to have a narcotic addiction and an opioid addiction, and he was also suffering from bipolar disorder, and that ultimately, all of those factors really played a role in his tragic death several years ago. So, really close to home.
I also have some experience with opioids. 2 years ago, I had a really bad infection that was extremely painful, so I had to take opioids because it's the only thing that relieved the pain. And I only took 2 or 3 pills, and I took them at a longer interval than it said on the bottle, and I still got withdrawal symptoms for only taking 2 or 3 of them for a day or two. So I don't even know what would have happened if I took the whole bottle.
So we will be discussing the opioid epidemic, which clearly, based on those very personal stories, it is a very large issue that affects a lot of people. We're going to focus on the epidemiology of it, so we'll start with a little history, then get into kind of who it affects, and then some efforts to stop it.
So first, what is the opioid epidemic? Opioid epidemic refers to a serious healthcare problem that is due to an increase in increase of use prescription opioid drugs, and currently there's not much being done for the opioid problem. So a little history about the opioid crisis. So it started in 1960s during the Civil War, when opioids, especially morphine, are used to treat the soldiers who are wounded. Then in 1898, there is the introduction of heroin, which was supposed marketed to be less addictive than morphine. And then in 1910 to 1912, we had the restrictions on narcotics, which the government said that people cannot have narcotics or opioids without prescriptions. Then in 1970, we had the controlled substance laws, which is kind of limiting the usage of opioid and these drugs. Then in 1995, oxycodone appeared, which is marketed to be this very mild drug that it will have no addictions, not much side effects than like what you think opioid drug kind of does. And then now in 2017, we are in a state of crisis where the U.S. formally declared that we have an opioid crisis. So problems we have known from the history, which is one, doctors are overprescribing these opioid drugs to treat pain, and that the drugs are mostly more covered by the insurances, and therefore are like a better alternative than other alternatives available. And opioids are like more marketed as non-habit inducing and moderate drugs that you can use, but like there's no evidence or research to back it up. And do you guys know that there's a positive correlation between the free meals that the doctors receive from these pharmaceutical industries, and there is like a higher chance for them to prescribe you the drugs that the pharmaceuticals make.
Okay, so now that you have a little bit of background and whatnot, how many people do you think are suffering from opioid use disorder? Okay, yes.
A lot.
Yeah. Answer. So 2.1 million people in the United States suffer from opioid use, which is a lot of people. And so, to get into who's affected exactly.
Yeah. So there's different ages and genders that are more likely to be addicted to opioids. Deaths due to opioid use has increased rapidly across all races, gender, and ages over the past several years, but 76% of opioid-related deaths occurred in those under 50 years old, and the greatest exposure to prescription opioids is those 26 years old plus.
And over.
Oh, and over. The highest non-medical use in young adults that are 18 to 25 years old, and men age 18 to 34 are almost 3 times more likely than women to be addicted to opioids.
And now to get into the race and ethnicity differences, which once again, just to reiterate, this is really an incredibly widespread issue, so it has affected all races and ethnicities. There's been increases all over. But to get into the specifics, back in 2018 to 2019, so kind of the first year or two of when this epidemic began, there was a 38% overall increase in overdose due to opioids in non-Hispanic Black individuals, whereas all other races, they kind of stayed the same. And then in 2020, opioid use-related EMS activations increased the most among Asian individuals by 44%. And now to look at, not exactly now, but to look at just overall overdose deaths in 2021, it was 67.9% white and 19.2% Black Americans. And so there is clearly a lot of differences and whatnot, and one of the reasons for these differences is in doctors prescribing. There is a lot of inequity. One example of this is 74% of white individuals were prescribed pain medications for extremity fractures, whereas only 57% of Black individuals were. And kind of a similar study found that only 35% of minorities with recurrent cancer were given the proper medication, whereas 50% of whites were. And so, yeah, this just shows that not everyone is being prescribed when they should be, and some people are when they shouldn't be.
And here we have some data to illustrate those points.
Yes.
Moving on. So now that you know all about the opioid crisis, in order for public health to tackle this really big, broad issue, we have to know what rehabilitation and treatments are effective. So the most common and effective treatment for addiction or opioid use disorder is medication, and these medications help normalize brain chemistry, relieve cravings, and prevent withdrawal symptoms during recovery. And listed on the slide are some examples of these medications, and it should be noted that methadone can only be used in secure treatment facilities. And then along with medication, behavioral therapy is effective in treating opioid use disorder. And as the CDC put it, the overall goal of treatment is to return people to productive functioning in their family, workplace, and community. Now that we know about what treatment works, what is the government doing to help fund and make these treatments accessible? So in 2008, the Mental Health Parity and Addiction Equity Act was passed, and this was basically making sure that insurance plans cover mental health treatment in the same way they cover physical health treatment. So you get a surgery paid for by insurance, you should also get your addiction treatment paid for by insurance. Other efforts to achieve parity or equality were the Affordable Care Act, passed in 2010, which again had some other efforts to increase payment by insurance for mental health treatment, and the 21st Century Cures Act, passed in 2016, which is involves the FDA and just the more speedy and efficient release of drugs so that people can benefit more. And of course, one of the biggest parts of public health is educating the public. So there are plenty of resources. The CDC and the Department of Health and Human Services have lots of links to treatment, information, and facilities, and all that kind of stuff.
So some key takeaways from this whole presentation is that doctors contribute to the opioid epidemic by overprescribing.
And another is that the Mental Health Parity and Addiction Equity Act is one way the government is trying to mitigate the opioid epidemic. And now we have some time for discussion. First, we'd like to give our personal thoughts on this issue. As we've seen, opioid addiction is very widespread and causes many, many deaths across the country. So it's really an issue we need to deal with quickly. We need to end the stigma around opioid addiction and make sure people are supported in seeking treatment.
What?
Did we?
Just
You
personal
know about that?
takeaway.
Oh.
Yeah.
we can move on to discussion. Do people in the class have any personal opinions to offer?
Okay, great. Thanks for sharing.
And now for some discussion questions we prepared, we'll just list them off. One, what are some ways the government can help those struggling with opioid addiction? Time to answer. How could doctors be trained to not overprescribe? Answer. And why is there a discrepancy between prescriptions written for Black individuals versus white individuals? And that is our presentation. Thank you for
Ooh.
listening.